today I'm talking about obesity, and my background is like I practiced internal medicine for almost 27 years, and during my last 27 years what I have noticed that 80% of office visits anywhere in the world, like here in Pakistan or in US, they were related to chronic medical illnesses like diabetes, hypertension, osteoarthritis, coronary heart disease, depression, anxiety. So these are all lifestyle related medical issues. And among all these chronic illnesses, obesity is one of the major concerns. So in the beginning, I never realized that is like something we never paid attention to it, because obesity is something like people, they don't pay attention and they take them very light actually, because nobody considered it as a disease, a chronic disease. So during COVID, like after practicing like all these like 20 years, I realized that like every patient who's coming, like all these diseases we are talking about, hypertension, hyperlipidemia, GERD, coronary heart disease, they're all connected with one entity, and that is lifestyle. And among the lifestyle, the root cause was obesity actually. So with this, I actually did my fellowship in lifestyle, because I realized that I need to learn something more, what is lifestyle medicine means, and that opened up my horizon. And then I did certification in obesity because I wanted to learn more about what is going on with these patients. And then later, the ultimate thing which I did is integrative medicine. So integrative medicine was actually a combination of conventional medicine, alternative medicine, and complementary medicine. So there is a perception among people that integrative is something like functional medicine or alternative medicine. So it is not. We do not take away conventional part of medicine. So conventional is always there, which is like the one we practice every single day. And we add alternative. So basically we are including the whole world system of medication. So Chinese medicine has its own importance. Indian medicine like Ayurveda is important. So with this, I would just start my talk, because I'm trying to cover a very big topic. Some of the slides I will skip because I know my target audience, and certain slides I will pay more attention than the other ones. So this lecture was actually a CME lecture, which I did it, usually do it in the US. So it is more detailed, but I think I'm going to come to your level and just skip some slides very fast. So obesity, if you look at the definition, the one defined by Obesity Medicine Association in 2018, it's a chronic, which means that this is not something acute. Relapsing, it means it comes and goes. So even if you lose weight, there is a very high chance that you will gain weight again. Multifactorial, there are multiple reasons for having overweight and obesity. Neurobehavioral disease, wherein an increase in body fat promotes adipose tissue dysfunction and abnormal fat mass, physical forces resulting in adverse metabolic, biochemical, biomechanical, and psychosocial health consequences. So in the past, we used to think like obesity is a dead organ, dead tissue, but it is not. It is just like another endocrine organ. Society perception of body weight. In the past, if you look at the population pictures, in 1947 or 1930s or early, 20th century, you'll see like a population, they were thin, lean, smart. But if you take pictures of a group of people, you will realize that you have a larger size population. Chairs in medical offices have gotten wider and stronger. So most of the data I'm presenting today is US based actually, but this can apply to anywhere in the world. What used to be size 10 dress is now labeled a size 6. So basically you are lowering your threshold, like you're telling the patient like you're not 10, you're 6. So our population is growing larger with each decade. While models with larger body types are beginning to appear in advertising, our society has still a judgment and shame that is overtly directed at those who are overweight and obese. So now even in US marketing, they are also including people with overweight and increased BMI as a marketing module as well. So it's not like in the past, there's some stores, they were selling, they were showing like a muscular people. Now they are also showing overweight people in their marketing. Many healthcare providers view obesity as a choice. So this is where the judgment comes. And one that is under the behavioral control. Studies have shown that physicians spent less time and had reduced communication with patients with obesity. 28%. So there was a survey done by first year medical students, and they found out that 28% thought that patients with obesity are lazy, and 74% believe that obesity results from ignorance. Nutrition education is lacking in medical school, residencies and fellowships. So is the topic of obesity. Obesity is unattractive. The treatment is to just eat less and move more. This is the concept of treating obesity. Eat less, move more. The Obesity Medicine Association recommends terminologies that recognize the person's first rather than the disease. Encourage terms weight, unhealthy weight, overweight, body mass index, excessive energy stores, altered, affected by obesity. And we discourage the terms like morbid obese. This is a very common term which we used to use when we used to write notes, and obese and fat. So these are the words we should discourage it. Demographics. 600 million people all over the world, like globally, they are obese. Most of the world population lives in countries where obesity causes more mortality than being underweight. Major chronic conditions affecting our country and world, including heart disease, diabetes and certain cancers, they are connected with obesity. The medical cost approximately 140 billions, and many agencies like World Health Organizations and American Medical Association have defined obesity as a disease. Obesity in the United States. Over the last 2 decades, the interesting point is that when they predicted, they thought like this is the number they will achieve in the next 50 years, like by 2050. Unfortunately, we have achieved that number by now. Even by 2010, we were expecting that the number we'll achieve in 2050, that number has, they achieved in 2010. So this is how obesity is going in the last 2 decades. It is exponentially, increasing. What are the disease association with obesity? So sometimes you don't realize that. Most of the time we think like hypertension, coronary artery disease and diabetes, they are the 3 major, things, but this is not true. Cardiovascular disease, atherogenic dyslipidemia, which means like the cholesterol which cause blockaging of the arteries, cancers. Now you will be surprised that how cancer is coming from obesity. Breast cancer, the #1 killer in females, breast cancer. It is due to, if you read the new guidelines, the risk factors, weight gain and obesity can cause breast cancer. Even patients, when they diagnose with it and they go for treatment and you complete the treatment, patient is breast cancer cured. Again, the only thing which can lower the mortality is their lifestyle, and you teach them to exercise and control your weight. So the game never gets over with just a chemotherapy and surgical removal. Cancer always comes back. So lifestyle has a very important role in keeping the weight stable. Same thing, prostate cancer, diabetes, respiratory disease, kidney disease, non-alcoholic fatty liver disease, very common. You all know about this. Everybody in Pakistan, they're getting ultrasound and they see like fat in the liver. But this is not something benign. It can cause liver cancer. It can lead to cirrhosis and do those things. Neurocognitive decline, your mental, level and cognitive impairment is more common in obese patients. Mental disorders like depression, anxiety, very common. Low self-esteem in obese patients. Musculoskeletal disease and sleep disorders like obstructive sleep apnea and insomnia. So just look at this picture. You see diabetes, type 2, this is like just a quick pictorial representation of all these complications which you can get with obesity: high blood pressure, high cholesterol, gallbladder disease. Females, they can get very early gallstones in their gallbladders. Then fatty liver disease, cancer, osteoarthritis, sleep apnea. Cardiovascular disease, now I'm just quickly giving you a hint of what it does. CVD risk, they have increased. So it's not just blocking the arteries. It also affects the heart muscles directly, like it can cause left ventricular hypertrophy, cardiomyopathy, and obesity in and itself can cause cardiomyopathy, not through atherosclerosis, but also directly affect the muscles. Atherogenic dyslipidemia, another complication of obesity, an association. Patients who are overweight, obese, they have a very high chance of having high cholesterol level, which can lead to many other complications. Hypertension, another common. These are all these diseases which I'm telling you, like they can lead to obesity. Cancer, I already mentioned about breast cancer, endometrial cancer, and renal cancer. Very strong association with obesity. How? Chronic inflammation with expression of TNF, tumor necrosis factor alpha, and interleukin 6. These are inflammatory markers. Diabetes, I already mentioned. I think the slide just got, okay. So, and if you look at the diabetes, it overlaps between type 2 diabetes and obesity. Approximately 50% of obese patients, they have diabetes. Starting at a BMI of 27.9, the risk of type 2 diabetes increases by, like, very exponentially increases. And if the BMI is greater than 29.4, the risk increases by 300%. Respiratory diseases. Now look at this, asthma, bronchial asthma. Because obesity can lead to inflammation, so inflammation goes everywhere in your body actually. Just think about it. Wherever the inflammation is going to go, it's going to affect those organs. And other things like mechanically how it affects the respiratory system through obesity, hypoventilation syndrome, restrictive lung disease because they cannot expand their lungs. So sleep apnea and asthma. Kidney disease. Who knows like obesity can cause kidney disease. It can lead to chronic kidney disease through inflammatory pathway and reduce renal function in patients with obesity seen in the absence of hypertension or diabetes. So patients who are obese, they can also get diabetes and hypertension, they can get kidney disease without having diabetes and hypertension. So there is something which is causing it, and that is, so patients with obesity, they can have like a focal glomerulosclerosis, one of the condition of chronic kidney disease. Non-alcoholic fatty liver disease, I'm not going to spend more time on this. Everybody knows about it. It's a fat in the liver, and diabetes and obesity are the main cause of this liver disease, and treatment is lifestyle modification. Why it is important? Because every second patient in Pakistan right now, if you do their ultrasound and do a study, you'll find out it is such a common thing. And looking at the number, 20% patients will progress to cirrhosis of liver, because the next stage is NASH, which is non-alcoholic steatohepatitis, which is inflammation. When the liver enzymes goes up, then it causes, you can tell that this is inflammation going on in the liver, and that lead to cirrhosis, and cirrhosis can lead to liver cancer, just like Hep C. So now in Pakistan or all over the world, I would say that you should not take it serious. You need to focus on these things. And again, lifestyle is the way to go. Neurocognitive decline. As I mentioned earlier, obesity in midlife and dementia and Alzheimer's disease in late life. So these are studies, in 2018, there's a data presented. BMI of greater than 30 doubles the risk of dementia. Neurocognitive decline at age 50. And how it is hypothesized that obesity sets up the milieu for dementia through insulin resistance, cardiovascular disease, gut-brain interactions, and inflammation. So as I mentioned earlier, inflammatory markers, they absorb from your gut, they goes in your body, and they affect your brain as well, because wherever the markers are going, they are affecting it. And this is how one of the reasons obesity can cause depression as well. Depression is very common in obese patients. In a group seeking bariatric surgery, 25 to 30% were clinically depressed. This was the data they found out, because before sending patients to bariatric surgery, we do at least 6 months evaluation of that patient. We give 6 months to look at their nutrition pattern. We send them to psychologists to find out. So we don't just patient goes to a surgeon and he will operate. he gives 6 months to that patient to evaluate. And during those things, we find out how this patient is doing, what are his underlying risk factors, and even if you do operate their patient, what his future trends will be regarding eating and because if he's depressed, no matter what you do, he's going to eat again and he's not going to get any benefit out of surgery. Fertility issues, another common issue. In Pakistan, all over the world, when you come across patients like who are seeking conception, and you see like they're not getting conceived, obesity plays a role as well, because it can lead to insulin resistance, and insulin resistance can cause multiple issues like metabolic syndrome, polycystic ovarian disease, hormonal imbalance, that can affect fertility. Physical function. Physical function is another thing, because patients it's vice versa. So physical inactivity can lead to obesity, or obesity can lead to physical, it's a bidirectional problem. So obesity leads to marked disability and impairment of activities of daily living, and obese patients have high risk of osteoarthritis. There are two ways of getting osteoarthritis. One is, most of the time we think like osteoarthritis, obese patient can get OA like osteoarthritis because of the mechanical forces, but it's not only mechanical forces. As I mentioned earlier, it's an inflammatory disease as well, so the inflammation can also affect the cartilage. So we have Dr. Ziaul Awirk, he's a rheumatologist, so if I'm, so he can, polypharmacy. Obese patients have multiple chronic medical problems, and they are on multiple medications, and those multiple medications can lead to mineral deficiencies, and these patients can have micronutrient deficiencies due to polypharmacy. These are all the complications of obesity, actually, the one I'm just telling you, giving an idea how it can affect. So I personally think that this is a place where I need to spend more time. I will skip the management part very fast, because if you know this part, you will have, you will understand what I'm talking about. Metabolic syndrome, you all hear this term. It is a truncal obesity which can lead to insulin resistance, hypertension, and profoundly atherogenic dyslipidemia. Why we are putting more pressure on this term, metabolic syndrome? You're hearing this word again and again, because this is a precursor of coronary heart disease, diabetes, hypertension, depression, just name it. You just think any disease, it is connected to this problem. Metabolic syndrome in childhood and adolescence, you can see that they, like in teens, their waist circumference is high, HDLC is low, increased plasma triglyceride, increased blood pressure, increased fasting glucose. हम सब के घरों में बच्चे हैं और हम सब इसको बड़ा इजी लेते हैं. हम कहते हैं अभी बड़ा होगा, हाइट निकलेगी और सब कुछ ठीक हो जाएगा. लेकिन वहीं पे उस बच्चे के अंदर चेंजेस आ रही होती हैं, because it is not only the fat accumulation. There is one thing, brain में changes आती हैं बड़ी significant. The functional MRIs have been done recently, and they're figuring it out. Patients who have obesity and they're overweight, they have changes coming, functional changes coming in their brain. So there are certain areas of their brain which is affected by overweight and obesity, and those are like prefrontal cortex and amygdala. So their emotions can be affected. So anything can happen. Just a quick review, like a fitness, ये slide अगर आप देखेंगे इसमें आप नजर आएगा तो decreased fitness, chronic positive energy balance shift हो जाता है. Genetic factors, they also play a role, which leads to increased adipocyte size, like a fat cell increases. जिसमें ज़्यादातर fat जो है, it will go to liver, and rest fat to legs. Adipose tissue inflammation, as I mentioned earlier, and they secretes adipokinins, metabolites and immune cells, which can cause these chronic diseases, which you can see on the left side. Measurements of obesity. So there are multiple ways. The most commonly we use BMI, abdominal circumference, waist to hip ratio, body fat percentage, skin fold thickness. These are common ones. We use it in our clinics, but there are certain specialized. They are only used for research purpose and academic in the tertiary care centers and academic institutions. DEXA, which is like a bone mineral density. This is what another classification. Normally, the BMI should be between 18.5 to 24.9. This is body mass index, and it is weight in kgs over area in square meters. And overweight is 25 to 29.9, and the risk of comorbidities goes up with overweight patients. And obesity is like 30. If BMI is above 30, it is obesity. And there are different grades, you know. If it is above 35, it's a grade 1, and grade 2, and grade 3, above 40. Waist circumference is another modality which helps us determine obesity, because some of the, I will explain you why. Normally weight should be less than 94 centimeters, and overweight patients have 94 to 101.9, and obese patients have more than 102 centimeters. And for women, it's different. So they have 88 centimeters above, that is obesity. And for Asians, the criteria is different. So you see, like in Asian population like Japanese and Chinese, their criteria is different. So their obesity comes from like 20, the overweight is 23 to 24.9, and obesity is above 25 actually. So for Asians, Chinese, because उनकी जो body morphology है वो different होती है, तो उसकी वजह से उनके criteria different है. BMI, I don't want to spend too much time on that. You can study. It does not address body composition. So there are some glitches why BMI is not important, like does not hold good for everyone. Muscular people, multifactorial etiology. So another very important slide. So if you look at the multifactorial, obesity, like many chronic diseases, is a complex disease with multifactorial origin. Nutrition, physical activity, inadequate sleep. Did you notice that, what I put it over there? Inadequate sleep. So environmental toxins, stress and anxiety, depression, inflammation, drugs, excess alcohol, microbiome, infections, and social relationships. If you look at this thing, nutrition, obviously, if you're over consuming food, if you're eating processed food, if you are not eating mindfully, that plays role in weight gain. Then physical activity, we are seeing the trend, we are sedentary, we are spending a sedentary life. If you look at the last 50 years, our TV time has gone up significantly. Then you can see inadequate sleep. The whole world is facing this problem. You are playing with your circadian rhythm actually, and that plays a very important role. There is one hormone, when you come across, like you're in first year, you'll read in physiology, spend more time on melatonin. This is one of the hormones we never paid attention when we were student actually, because this was the least, because it was coming from a very small gland, pineal gland from the back of the brain, and we said, where that hormone comes from, pineal gland, that's it. This is the only, and it helps in circadian rhythm. We never paid attention to this hormone, but today, if you ask me, I call it melatonin is a queen of hormones. Why? Because at night, that queen should be at higher level, and it is interacting with your insulin, it is interacting with your cortisol level or cortisol, it is interacting with your adrenaline. That's why your heart rate variability is affected. People with have high blood pressure, we also ask about the sleep as well, because no matter what medicine you use, if he's not sleeping on time and his melatonin is affected, his heart rate variability is low, then the blood pressure is going to be high regardless. And stress and anxiety, depression is another cause of having this obesity. Same thing, inflammation. I mentioned, whatever we are eating, it is absorbing through our gut. And there is another important thing in our gut, which is microbiome. I'm spending more time on this slide, but I will skip the other slides very fast. What microbiome does is actually whatever you're eating, microbiome is a good bacteria in your gut. We have, like bad bacteria and good. So like one thing you hear, like I'm talking about eat fiber. Fiber is a food for those microbiome. Whatever we are eating, whatever we are doing, somehow in Pakistan everybody is on antibiotics, Choti si bimari bhi hoti hai, to we put them on antibiotics. What antibiotic does, it kills the bad bacteria, it also kills the good bacteria. It changes the whole value of your intestine. Because जो आपके microbiome है, it is more than your own body cells. They are converting जो fiber है वो उसका food है. Usually we think fiber is for bulk. But no, this is not the only reason we need fiber. Fiber is a food for those microbiome. What it does, it converts short chain fatty, like it converts certain things into short chain fatty acids, which is butyric acid. That butyric acid absorbs in the circulation and reduces insulin resistance. It improves insulin sensitivity. It creates a very important role in inflammation. That's why we are spending more time these days on microbiome. Western world is, and even in Pakistan, people are getting more educated, and the one who knows about microbiome, they are prescribing probiotics, and they're eating probiotics. Social relationships. Why social? If you are sitting with 5 people who are overweight, you don't think this is a problem because you will perceive it as a normal thing. But if you're sitting with 5 healthy, motivated people who goes to gym and exercise, you will try to change yourself as well. So that's why social relationships are important. If your wife is healthy and she's health conscious, she will make your life, Over 43% of energy consumption is from processed food. जो आप सब लोग खा रहे हैं, जाते हैं, you eat like chips, French fries, all these things are processed, in high glycemic loads, teas, sugar, coffee, and the way I'm seeing right now, all these kids and young kids, they are going to Gloria Jeans and, sorry, मैं किसी का mention नहीं, it's a bias, but it's not bias. I'm talking about everyone, Coca-Cola, Pepsi, or just name any Starbucks. They're selling drinks which has like so much fat, So this is something we need to do advocacy. Paucity of real food. We are not focusing on real food. Everybody thinks that juice is better than fruit. Eat whole fruit. Unhealthy food environment with reduced energy expenditure. We have more restaurants than we have healthy places to burn those calories. Dietary protect. This is something I need to let you know. A protective role against weight gain for higher intake of dietary fibers and nuts, higher intake of whole grains, cereal fiber, high fat dairy products. A protective role against increased waist circumference is higher fiber and fruit intake, lower intake of refined bread and higher energy density food, and less protective role and higher prediction of weight gain for high meat intake. So meat is not good. Please reduce meat intake. Go for whole food plant-based diet, and I will tell you what whole food plant-based diet is. Whole food plant-based diet is like that. You see berries, you see all these fruits sitting over there. You pluck that fruit from the tree like apple, you wash it and you eat it. This is what we call whole food plant-based diet. As little processing as you can. Conventional nutrition approaches toward calories. We all talk about calories. But calorie is not, there are certain, like you eat almond butter, 100% of the calories will absorb in the circulation. But if you eat the same almond, only 1/3 of the calories will absorb. So basically, calorie is not the only thing you look for. So you need to look for what you're eating actually. That's why you see like I eat nuts, and I'm healthy or something like that, but the other person. So yes, I know calories are very high in almonds, but only 1/3 absorbs. And there are other factors which plays role, your environment, your activity. So this is not the only thing. Food that is high in whole grains and fiber is not digested as sufficiently. Like I see wherever you go, they serve you orange juice, they serve you different juices. So, and you can have 3 oranges with the same juices, there's a big difference. That sugar which is you are consuming through oranges and the whole fruit is absorbing very slowly. And not everything is going to be absorbed. The fiber is going to keep certain things good in the gut. But if you have that same orange juice, it's going to cause insulin to shoot up like that, and then it's going to come down sugar like this again, and you'll be hungry again. So you'll be eating more. So this is how you need to know the patterns of eating. Another important thing, you guys think artificial sweeteners. Very common practice. Everybody is having these. So right now, I don't support these artificial sweeteners because they change your microbiome, they change things in the brain, which increases your carb intake. And some of them, they got banned recently by FDA. Stevia is another name you guys hear. It's pretty safe. It's a little bit safe as compared to the other one, but the best way is because even if people, they start using more stevia, it increases their carb intake as well, because it increases that urge to eat more carb, like sweet actually. Even though you're not eating sweet in the tea, but it is pushing you to have craving. It increases your craving to have more sugar in your body. There are hundreds of diets. So this is the question which always comes to me, like, what is the best diet? I would say the best diet is the one patient can be on it for a long time and he feels happy. That is the best diet. And then moderation is the way to go. So you need to moderate your diet, like you know what you're eating actually. So this is the best answer for like the best diet. No single diet is recommended for weight loss. There are eating patterns that are associated with weight loss. Consistency, lifestyle, that is the way to go. Mediterranean diet. We all hear about this diet, Mediterranean diet. Yes, it is a very good diet. It keeps the weight maintained, but it is not like a too important for weight loss, but it is cardiac healthy diet actually. This is one of the most recommended diet in every, like even inflammatory joint diseases, we recommend Mediterranean diet. Inflammatory, cardiac diseases, we recommend Mediterranean. What Mediterranean diet means? Vegetable, fruits, nuts, whole grains, legumes, and low consumption of red meat. It's an eating pattern. And it decreases waist circumference, and it also prevents obesity and abdominal adiposity. Very low carb diet. आप लोग सब सुनते हैं वो keto diet और ये सारा कुछ. I'm not a big supportive of that because it can lead to some other complications like high cholesterol and cardiovascular disease as compared to, so again, moderation is the way to go. So when you reduce your carb intake to 5 to 10%, obviously you are having like 75% fat, but then you lose that quality actually because you don't know the fat you're having. Is it like it does have a saturated, how much saturated fat is that, or trans fat, so you can have it. So, but I would say, and these diets, they don't last for a longer period of time. You give up because of their side effect. And one of the things people they do get is keto flu, which includes lightheadedness, dizziness, fatigue, difficulty, exercising, poor sleep, constipation, and tend to resolve within a few weeks. Juicing, detoxification, yes. Some people do it juicing with the vegetables and do it but it is only for a few weeks actually. You can't do it forever. Closing thoughts about this thing. Most diets are successful in short term for weight loss due to chronic restriction. Diet is the only one aspect of weight management. Exercise is good for weight maintenance, but the number one thing is you need to start with watching a diet. And best diet is the one, again, I already mentioned, is the one individual will stay on and will be happy with. Breakfast. There are different school of thoughts, we used to eat, recommended to eat more in the morning, medium in the daytime, and less at night, So this is how we recommend. Intermittent fasting, yes, I would like to mention here. Currently, you are hearing a couple of things like everybody's asking about injections like Ozempic, semaglutide and liraglutide, which is causing weight gain. What it does actually, it just suppresses your appetite and slows down your gastric motility. It does not cause weight loss. It is causing weight loss due to suppressing your appetite and slowing down your gastric empty. So if a food is passing in 1 hour, what it does actually, the same food is passing in 8 to 10 hours. That's why you don't eat. This is why the medicine is successful, but it has side effects. What intermittent fasting does, like if you restrict your eating in a 10 hours window, you have a choice to eat food of your choice actually, and then you are fasting for 14 hours. Try to make a habit of eating at 6:30 at night. And the biggest mistake we do it, even though we implement this 6:30 p.m. Dinner, but if you do not sleep at 10 or 9:30 p.m., then you will have another meal at 10:30 or 11. So this is the mistake we make it. Intermittent fasting is good, but then you need to combine it with sleeping pattern as well. So you sleep 8 hours, wake up at 6 o'clock, start your day with namaz or prayers, whatever you like to do, and then you have your breakfast at 8 o'clock. Perfect 14 hours fasting, and there are various studies coming. It lowers cardiovascular risk, diabetes risk, weight loss, number one, if you ask me, I'm a big advocate of intermittent fasting. So now I'm going to go a little bit fast. Intermittent fasting is of different types, 5 to 2, alternate day fasting, alternate day modified fasting. But the one I recommend, which is practical, is time restricted eating, which is like you are restricting your food intake to 10 hours. Meal timings and circadian rhythm, very strong connection. As I mentioned, hormones are controlled by a circadian rhythm. So basically, I would say in Pakistan, where 95% of you guys are Muslim, that Allah subhanahu wa ta'ala is controlling the whole body with light and darkness. And there are certain places where Allah has, qasam khai unhone for day and night. So that shows importance of day and night. So day and night is very important. So you guys are student, and I know nobody is following. 80% of you guys may not be sleeping appropriately, but that is the root cause of everything. Diet, chronic diseases. So circadian rhythm is important. So this is the first question I ask when I see patients with overweight and they come to me for counseling and treatment. These are certain supplements for weight loss. We use it, like maybe you guys are studying this, and capsaicin, conjugated linoleic acid, green tea. Most of the clinicians, they recommend L-carnitine, ephedra and bitter orange, but some of them, they have side effects as well. Physical activity, very important. I mentioned earlier in my talk, sedentary lifestyle has increased in the last few decades, and that needs to go away. We need to be active. Working stations. In college, we need to have something, for the students, where instead of sitting and chatting, you can go and do treadmill. This is what I encourage actually. What it does, it increases your telomere length, improve your emotional and physical health, and improve arterial stiffness and lipids. This is the benefit of exercise. And they also improve your brain and cognitive function. So those students who walk daily and who do exercise, their cognitive level is very high. It helps your brain. It helps brain drive natriuretic factor, which is a hormone to grow neurons. And brain is only one organ in our body which grows with age. So this is the only organ of the body. If you continue to work, if you continue to do our mental exercises, it grows. So an exercise helps that growth as well. Exercise and obesity, there are different ways you can do it. So I'm just showing the pictures. And then when you are counseling exercise, so make sure that patient should be healthy before you advise him for treadmill or any kind of HIIT training. Make sure that what are his risk factors, before you recommending gym. And always get him evaluated by a physician before you tell him to go on a treadmill and start running. Especially anyone after 40 even I would say anyone after 35 in Pakistan these days. And during exercise, you can monitor heart rate, glucose monitoring when these patients are, like if they are taking any medications. So these are certain recommendations. Fit. Clinicians, if you, I have clinicians here, write a prescription of exercise to these patients. We call it a FIT, which is frequency, intensity, time and type. You have to give prescription to your patients. This is important. So different age groups have different kind of management. So surgical management, the criteria is if somebody's BMI is more than 40, he is a candidate for sleep gastrectomy or bypass surgery. But he needs to be criterion, as I mentioned earlier. We monitor them for 6 months. We don't just put them on surgery right away. These are very important. And then we also follow up these patients by a physician so that they do get electrolyte imbalances and all these complications which needs to be monitored. So these are not simple procedures, but yes, they do have benefits. Why we put these patients on these kind of risk, of surgical interventions? The reason is you need to weigh the risk and benefits. If you don't operate this patient, will these diseases kill that patient, like diabetes or heart disease or something else like obstructive sleep apnea or sudden cardiac death? So you need to weigh, if I do surgery, this patient will lose 50% of his weight, and his diabetes will reverse, his hypertension will get reversed, and he will get lesser complications of anything because they get significant weight loss after surgery. But surgery has a risk. So keep in mind these things. So with this, I would just conclude. I'm not going in detail of that. I gave you a touch of medication, surgery, and everything. And then we do extensive workup, PFTs and ultrasound and CTs or labs before sending patients for surgery. It's a very extensive workup. So this is what I'm just showing in the slides, So it's not that easy the way it looks like. Sending that patient, it's like a 6 months process before we send that patient for surgery. Okay, thank you very much for listening. This is such a long talk. And just due to the time constraint, I have to stop here. So I'll be happy to answer and take your questions. Thank you so much.